Polycystic ovary syndrome, or PCOS, is often misunderstood. It's much more than just a reproductive disorder. PCOS is actually a complex hormonal condition that affects women throughout their lives. It impacts metabolism, inflammation, and overall well-being. One of the biggest myths surrounding PCOS is that you need to have cysts on your ovaries to be diagnosed. This is simply not true. While many women with PCOS do have cysts, they are not a requirement for diagnosis. PCOS is a syndrome, meaning it is a collection of symptoms that can manifest differently in each woman. Some women may experience irregular periods, acne, and excess hair growth, while others may struggle with weight gain, infertility, or mood swings. The key takeaway is that PCOS is highly individualized, and no two women will experience it in the same way. It's vital to remember that PCOS is not a woman's fault. It's not caused by lifestyle choices or a lack of willpower. PCOS is a complex interplay of genetics, hormones, and environmental factors that contribute to its development. Understanding this is crucial for women to shed self-blame and embrace a positive and proactive approach to managing their condition. Hormones act as messengers in the body, regulating crucial functions such as metabolism, growth, and reproduction. In women with PCOS, this delicate hormonal orchestra falls out of tune. Key players in this hormonal imbalance include androgens, insulin, and luteinizing hormone, or LH. Androgens, often referred to as male hormones, are naturally present in women, but at lower levels than in men. In PCOS, the ovaries produce an excess of androgens, leading to symptoms such as acne, hirsutism, and irregular periods. Insulin, a hormone that regulates blood sugar, can also be a major player in PCOS. Many women with PCOS develop insulin resistance, meaning their cells don't respond properly to insulin. This can lead to weight gain, fatigue, and an increased risk of type 2 diabetes. Luteinizing hormone, or LH, is responsible for ovulation, the release of an egg from the ovary. In PCOS, LH levels are often elevated, which can disrupt ovulation and contribute to irregular periods or infertility. Understanding the interplay of these hormones is crucial for developing effective treatment plans tailored to each woman's unique needs. Acne, a common skin condition, can be particularly distressing for women with PCOS. It's often more severe and persistent than acne experienced by women without PCOS. The hormonal imbalances inherent in PCOS are often the culprit behind these stubborn breakouts. Excess androgens stimulate the sebaceous glands in the skin, leading to increased production of sebum, an oily substance that lubricates the skin and hair. This excess sebum, combined with dead skin cells, can clog pores, creating an ideal environment for bacteria to thrive, resulting in inflammation and the formation of pimples. While acne is a common symptom of PCOS, not all women with the condition experience it. This variation in symptom presentation highlights the individualized nature of PCOS. Factors such as genetics, environmental influences, and the specific hormonal imbalances at play contribute to the presence and severity of acne in women with PCOS. Section 4. Hirsutism, beyond the surface of excess hair. Hirsutism, or excessive hair growth, is another visible symptom that can significantly impact the lives of women with PCOS. It's characterized by dark, coarse hair growth in areas where women typically don't have hair, such as the face, chest, and back. This unwanted hair growth can be deeply distressing, affecting self-esteem and body image. Androgens are the primary culprits behind hirsutism in PCOS. These hormones stimulate hair follicles, leading to thicker, darker hair growth in areas where hair is usually finer and lighter. The extent of hirsutism can vary widely among women with PCOS, depending on factors like genetics, ethnicity, and the severity of hormonal imbalances. It's important to remember that hirsutism is not merely a cosmetic concern, it's a medical symptom with underlying hormonal causes. Addressing hirsutism effectively requires a multifaceted approach that targets the hormonal imbalances driving it. alongside strategies to manage hair growth and its emotional impact. Section 5. The emotional tapestry of PCOS. The visible symptoms of PCOS, such as acne and hirsutism, can have a profound impact on a woman's emotional well-being. The relentless nature of these symptoms can take a toll on self-esteem, body image, and mental health. It's essential to acknowledge that the emotional impact of PCOS is real and significant. Women with PCOS may experience feelings of frustration, anxiety, and even depression as they navigate the challenges of managing their condition. They may feel like their bodies are betraying them, leading to a sense of powerlessness and loss of control. The social stigma associated with acne and hirsutism can further exacerbate these emotional struggles. It's crucial for women with PCOS to understand that they're not alone in this journey. Seeking support from loved ones, healthcare professionals, or support groups can provide a safe space to share experiences, gain valuable insights, and develop coping mechanisms to navigate the emotional roller coaster of PCOS. Section 6. Navigating the path to diagnosis. Diagnosing PCOS can be a complex process as there is no single test to confirm the condition. Doctors rely on a combination of clinical evaluation, symptom assessment, and laboratory tests to make an accurate diagnosis. It's crucial for women to advocate for themselves and seek medical attention if they suspect they may have PCOS. During a consultation, a doctor will typically ask about medical history, menstrual cycles, and any symptoms being experienced. They may also perform a physical exam to assess for signs of PCOS, such as acne, hirsutism, or obesity. Blood tests are often ordered to measure hormone levels, including androgens, insulin, and thyroid hormones. It's important to note that there is no one-size-fits-all approach to diagnosing PCOS. The diagnostic criteria may vary slightly, depending on the healthcare provider and the specific guidelines they follow. Open communication with a healthcare provider is essential to ensure a thorough evaluation and accurate diagnosis.